There's been a massive jump in the number of Australians resorting to surgery to tackle obesity. It's led doctors to set up an independent watchdog to monitor just how safe and effective the procedures are. Here's medical reporter Sophie Scott.
At his heaviest, Brian Robson weighed almost 140 kilos. After gastric banding surgery, he lost 40 kilos.
My insulin dependency basically disappeared on day one. Since then, my diabetes is now under control, whereas prior to that it was out of control. Sleep apnea has disappeared, and also my blood pressure is gradually returning to normal.
In the past 5 years, there's been a 300% increase in Australians having weight loss or bariatric surgery. That means as many as 14,000 obese Australians are going under the knife each year. In Australia, there's been little monitoring of how successful procedures are. So obesity surgeons are setting up an independent register to monitor the safety and effectiveness of gastric banding. It'll be run by Monash University.
In particular, we'll be looking at type 2 diabetes, high blood pressure and high cholesterol.
In the operation, a band is tied around the upper stomach, limiting how much food can be consumed. The latest research shows the procedure can reverse type 2 diabetes in obese people, though complications can occur.
The side effects that we see, in particular with gastric banding, are down the track. It can slip down the stomach or it can rub into the stomach. But these complications are fairly uncommon.
Demand for weight loss surgery is likely to increase. If Australians continue to gain weight at current levels, doctors estimate by 2020, 80% of Australians and 1/3 of children will be overweight or obese. Sophie Scott, ABC News.